Good morning, everyone. Thank you all for joining and making time for our campaign launch today. My name is Linda Kakolwa. I work as a policy and advocacy officer for UNASO. I hope I'm audible for everyone.
Hi, Linda, can you hear us from?
Yes, I can.
Morning, loud and clear. I can hear you.
Okay. So,
Great. I think we can go ahead and start, right?
can we give like a few minutes because the executive director for the National Public Health Agency, Sierra Leone, is very close. He had a quick catch-up. So can we please give him some time? Few minutes.
Yes, perfect.
Before
Perfect, no problem. Maybe in the meantime, we can go ahead and use the chat box to introduce ourselves and the organization you're coming from. Yes. We are being joined by Prof. Fadei Sir, the Executive Director of the NPHA, and he'll be giving opening remarks. So let's give him a couple of minutes so we can all start together. In the meantime, let's just continue to leverage the chat box to network.
Hello, Linda, are you there? No. No. Hello,
Yes,
Linda?
I can hear you. I can hear you.
Okay, so we have in our presence now the Executive Director for the National Public Health Agency, Professor Fodesa, is already in the conference room.
Good morning, Linda.
Good morning.
Yeah.
So we want to hand over to him so that we can start the process.
I just want to start by welcoming everybody to this meeting, both in person and virtual. Then it's a good step forward to actually our preparedness for emergencies. So when my team told me about this engagement and the project of moving this to the next level, that is into its implementation, really on behalf of the NPH and the Ministry of Health, are all excited. So I want to welcome to this meeting, and then I'll also take us through. Thank you.
Great. Thank you so much, Prof.
Okay. Thank you very much, Professor. I think we need to do a short introduction of those in the house here, and then we will do the virtual people before we continue. My name is Harold Thomas. I am the Health Promotion and ICC Advisor at the National Public Health Agency. Okay. The next one.
Chairman Sare, behavioral change and health promotion coordinator for National Public Health Agency, and also supposed to be the chair for this, but I'm handing over to Harold Graceful.
Good morning, all. Alassandra is my name, RCC Officer, NPHA.
Yeah.
Good morning, all. I am Abdul Kaid Ndewaiswari, the Director for Children Advocacy Forum.
Good morning, all. My name is Mama Dadi.
Above the volume. Okay.
Good morning, all. That's not choose.
Thank you. So I am Safandu Nkoma, the Chief Executive Officer for Coalition for Community Resilience and Transformation, the leading CSO for the community-led pandemic preparedness response campaign for Sierra Leone. So there's a team in the room. So we want to hand over back to you, Linda, as we steer the ship for the next phase on the item on the agenda. Can you please introduce your team from that end? And then, of course, we can get the rest from the chat box.
Perfect. Thank you so much, Andrew, and thank you so much to the NPHA team for making time for us and for taking charge of this very important initiative. From my end, from IENASO, me, Linda Kakolwa, Policy and Advocacy Officer and Project Lead for the Building Pandemics Ready Communities project, which is being implemented in Sierra Leone and in Rwanda in partnership with AHF country offices, but it is being funded by the AHF Fund. I am together with Mr. John, who will introduce himself. He's our technical lead, but I'm also joined with Madam Esther from AHF, who will also introduce herself. So maybe, John, you can go ahead, introduce yourself, and then followed by Esther and the rest of the team here.
Thank you, Linda. Thank you, Linda. Good afternoon, colleagues. Once again, it's nice to meet you all. Glad to be part of this process as we started from the training, I think a few months ago. So my name is John Beku. I'm a public health and policy specialist at IENASO. I'm working together with Linda in implementing this project. Once again, I'm very glad to be part of this process and to reach at this level and this stage in enhancing PPR engagement for communities and strategic partnership with our government counterparts who are the custodian of PPR in Sierra Leone. So glad to be here. Thank you.
Oh, thank you, Linda. Good morning, everyone. I am Esther and I work with the AHF Sierra Leone program as the prevention and advocacy manager. And I must say, on behalf of AHF, we're super proud to join NPHA and other CSOs to launch the community-led pandemic preparedness and response awareness campaign. I think recently we've all realized that communities play a greater role in ensuring that we end or be ready for any emergencies. So it's a pleasure to be here and I'm looking forward to a successful launch. Thank you and over.
Thank you so much, Esther. I think we are joined with almost 20 CSOs and other partners here who are part of the project. But I would like to formally welcome you all and we can go through our agenda. We have a few agenda items. We have the welcome, as I have welcomed you all here, and just housekeeping rules. Just make sure your mic is muted, and if you want to share something or ask your questions, you can use the electronic hand, and we will be happy to welcome you to share your insights, but also leverage the chat box as much as you can to ask questions and share your insights. That is also very much welcomed. And yes, as IENASO, our role in this project is to just champion and make sure we create a platform for CSOs to be on the front line when it comes to pandemic preparedness and response. We're just happy to be a participant of this beautiful platform, and I will just hand it over to Mr. Andrew Safar, who will be our moderator for today and who will take us through the agenda. But first, I think the following agenda item is to just welcome Prof. Fode, the NPHA Executive Director, to give us opening remarks and officially launch the campaign. Over to you, Andrew.
Thank you very much. Without wasting time, we want to hand over to the Executive Director for the National Public Health Agency for Sierra Leone to launch this campaign, and then we can move with the necessary steps.
Thank you very much, Andrew, and thank you, Linda and Tim, that side. Today is indeed a great day. Representatives of NSO and the AIDS Health Foundation, our representatives from civil society organizations, development partners, ladies and gentlemen, the NPHA team, and the Ministry of Health team. Good morning. Today is indeed a great pleasure and privilege to join you as we launch the community-led pandemic preparedness and response awareness campaign in Sierra Leone. On behalf of the Ministry of Health and the National Public Health Agency, I want to warmly welcome all participants and our colleagues from NSO, AHF, the Campaign Secretariat, and the Coalition of Sierra Leone and Civil Society Organizations for bringing this important initiative to life. This campaign comes at a very important time. The world continues to face the threats of emerging and re-emerging infectious diseases, and recent public health emergencies have reminded us that pandemics do not only test our health systems, they test our institutions, our communities, our economies, and importantly, the trust between the citizens and those responsible for protecting their health. For Sierra Leone, pandemic preparedness is therefore not simply a technical responsibility of the health sector. It is a shared responsibility. The central message of this campaign is one that the National Public Health Agency and the Ministry of Health strongly support, which is preparedness works when communities lead, systems listen, and partners act. That is what we are all looking forward to. This message reflects an important shift in how we think about pandemic preparedness. Communities should not be viewed simply as beneficiaries of government programs or recipients of public health messages. Communities are essential partners in preparedness and response. They are often the first to observe changes in health conditions, unusual illnesses, rumors, and concerns. They understand their local context. They know who people trust. They can identify barriers that may not be immediately visible to institutions. And they can play a critical role in ensuring that public health measures are understood, accepted, and acted upon. For this reason, community engagement must be integrated into preparedness before a crisis occurs, rather than being introduced only when an emergency has already begun. One of the most important lessons from previous outbreaks is that trust is a public health asset. When trust is strong, communities are more likely to report health events, seek appropriate care, follow public health guidance, and support response measures. When trust is weak, misinformation, fear, and suspicion can spread rapidly. We therefore have to build trust before the next emergency. This requires transparent communication, genuine dialogue, and consistent engagement with communities. It requires us to listen as carefully as we communicate. It also requires us to work with the people and institutions that communities already trust, including traditional leaders, religious leaders, youth organizations, women's groups, persons with disability, community health workers, civil society organizations, and the media. The second important area is early warning and early detection. Our surveillance systems must extend beyond health facilities and laboratories. Communities themselves are an important part of the country's early warning architecture. A community member who notices unusual illness, a health worker who identifies an unexpected pattern, or a local leader who hears a concerning rumor may provide the first indication that something requires investigation. We must, therefore, strengthen mechanisms that allow communities to report concerns quickly and safely. But reporting alone is not enough. We must also ensure that communities receive feedback. When communities provide information, the system must demonstrate that it has listened and acted. This is how we build a genuine two-way communication and accountability system. Ladies and gentlemen, preparedness must also be inclusive. Women, children, young people, persons with disability, older persons, migrants, and other potentially underserved populations may experience health emergencies differently. These needs, perspectives, and capacities must therefore be incorporated into preparedness planning. Inclusion cannot be an activity added at the end of the program. Inclusion must be built into preparedness from the beginning. A system that excludes vulnerable groups cannot be described as fully prepared. The National Public Health Agency also recognizes the importance of the One Health approach. Human health is inseparable from animal health and the environment. Sierra Leone's experience with zoonotic diseases demonstrates why collaboration across human health, animal health, and environmental health, including agriculture and other sectors, is essential. With us in Sierra Leone, we are actually even widening the net. We are now trying to bring in the Ministry of Water Resources, Ministry of Marine Resources, all those who want to bring them into the net of our One Health approach. Community-led preparedness can therefore help us identify risks earlier, promote appropriate behaviors, and protect not only human health, but also livestock and food security. Another important issue, ladies and gentlemen, is sustainable financing. Preparedness cannot be something we remember only when an outbreak occurs. We must invest in preparedness during periods of stability. This includes investing in community structures, surveillance, risk communication, health promotion, training, local leadership, and civil society capacity. Short-term projects can help initiate important activities, but sustainable preparedness requires systems and financing that remain in place between emergencies. Preparedness is a continuous process and a one-time project. I would like to particularly recognize the contribution of the civil society organizations in Sierra Leone and those participating in this campaign. The National Public Health Agency values the contribution of civil society as an important bridge between institutions and the communities. Civil society organizations can help us reach underserved populations, identify community concerns, strengthen accountability, and ensure that the voices of communities are reflected in national preparedness efforts. Similarly, our development and technical partners remain important in strengthening national capacity. However, partnership must be based on national leadership, community ownership, and shared accountability. The Ministry of Health and the National Public Health Agency remain committed to working with all partners to strengthen Sierra Leone's capacity to prevent, detect, and respond to public health threats. As we formally launch this campaign today, I would like to encourage every organization represented here to move beyond awareness and towards action. Let us strengthen the mechanisms through which communities can, 1, receive accurate and timely information. 2, ask questions and raise concerns. 3, report on unusual health events. 4, challenge misinformation and rumors. 5, participate in preparedness planning. 6, hold institutions accountable. And 7, contribute to response and recovery. I am encouraged participating organizations will nominate focal persons to coordinate their activities and ensure that campaign messages reach communities through channels they understand and trust. The success of this campaign should ultimately not be measured only by the number of webinars conducted or materials distributed. It should be measured by whether communities become better informed, better connected, more confident, and better equipped to act when public health threats emerge. Ladies and gentlemen, Sierra Leone has learned important lessons from Ebola, the Mpox, and other public health emergencies. One of those lessons is clear. We cannot build resilient health systems without resilient communities. And we cannot achieve resilient communities without trust, inclusion, participation, information, and sustained investment. Today, therefore, is more than the launch of an awareness campaign. It is an opportunity to reaffirm our collective commitment to a model of public health preparedness in which communities are recognized as partners, leaders, and agents of change. Let us work together to ensure that the voices of communities are heard before, during, and after public health emergencies. Let us build systems that do not simply communicate to communities, but communicate with communities. Let us strengthen partnership across government, civil society, and communities, including development partners. And let us ensure that preparedness remains a national priority, even when there is no emergency. I once again commend NSO, AHF, and Campaign Secretariat, the participating civil society organizations, and all partners for this important initiative. The National Public Health Agency is pleased to support this campaign, and I encourage all stakeholders to make it a meaningful platform for dialogue, participation, and action. With these remarks, ladies and gentlemen, I am pleased to officially launch the community-led pandemic preparedness and response awareness campaign in Sierra Leone. May this campaign strengthen trust, deepen community participation, and contribute to a safer and more resilient Sierra Leone. I thank you all.
Thank you.
Over to Leandro.
Thank you. Thank you very much, Professor, for launching this very important campaign. On behalf of INASO, AHF, and all the civil society coalitions and all of our colleagues connected online, inside and outside Sierra Leone, we want to say thank you so much. And we want to say that this is great. We have heard all what you have said, focusing on trust as public assets, sustainable financing, community feedback mechanism, inclusiveness, accountability, and ensuring that the pandemic response preparedness program should not only be when there is a pandemic, but it must be something that is built on systems. And therefore, we acknowledge that. Thank you so much. On that note, we want to move to the next item of the agenda, which is a technical overview of community engagement in pandemic preparedness and response from Mr. Harold Thomas from the National Public Health Agency in Sierra Leone. Thank you.
Thank you.
Linda, can you stop sharing so that I can put on the presentation of Mr. Harold?
Yes.
Okay.
It's showing the slideshow. Okay. Yes.
Okay, thank you very much, Mr. Safran. My presentation, my name is Harold Thomas once again. My presentation is going to look at the community engagement in PPR, and then I will also base my presentation on the theme preparedness works when community lead systems, listen, and partners act. Next. So preparedness starts before an outbreak. As we all know, for instance, even in risk communication, it begins before an event, during, and even after. So communities are the first line of prevention, direction, and response. And we also look at past outbreaks because they expose gaps in trusted information, inclusion, and coordination. And also look at local actors. Local actors often notice unusual events early, and then trust relationship turns alerts into action. And again, because of the new kid on the block now, which is behavioral intelligence and epidemic management, community engagement is therefore a core PPR capability. not an add-on. Let's go. So meaningful engagement turns voice into shared decisions. We need to inform, listen, involve, collaborate, close the loop and the shifts. So this is overly important. For instance, listening, you understand the concerns, the emotions, and beliefs of the people. And then this would actually build trust. Next. Community engagement turns through the entire process of PPR cycle. Prevention, for instance, promotes healthy practices and reduce local risks. And preparedness also, it joins planning, training, and preparedness and readiness exercise. And detection also is very much important in this arrangement because it identifies and reports unusual events early and respond. We need to support referrals, protective actions, and trusted communication. Recover, restore services, learn and strengthen resilience, and accountability is also overly important, as the professor mentioned earlier. We need to provide feedback on services and respond performance. Next. We would also briefly look at community signals before early warning when systems respond. Listening is very important. We gather signals through social listening, community dialogue, and health service feedback. In fact, with our behavioral intelligence and epidemic management, we have also added, emotional tone, which is very much important. So we gauge perceptions of people and even to know whether the messages they are sending is due to just concern, or if they are so aggrieved, or if we also need to look at this, so that we'll be able to find corrective measures. And classify, we separate information, concerns, rumors, and misinformation. Because, in infodemic management, it's a mix of all of this, over abundance of information. Some information, they are okay, and some, like the misinformation, they are not too bad. But when, experts like ourselves would go the extra mile in misinforming people, it takes light years in trying to, regain that trust. And so this leads us, we need to verify. We check signals with technical teams and trusted local actors. And we act, we adapt the RCC services or policies based on the evidence. And we also embark on, feedback, because this is a two-way system of communication. We tell communities what happened after they reported a concern, because what we do, we tell people what we know, and what even we are not sure, we tell people what we know, and then what we do not know, we are able to say, and we keep updating them as events unfold. Because in a situation where science is sometimes uncertain, we need to make sure that people get the right information. And also, it's important, Sierra Leone's behavioral intelligence and infodemic management system provides a pathway for community voices to public health actions, because we need, in today's world, we are not only looking at expert knowledge, but lay perspective. So there should be a fine balance between these two. Let's go. Trust and inclusion determines whether preparedness works. And if we are looking at community voices, we need trust. Trust grows through transparency, consistency, respect, and visible follow through, because we need to actually build this trust so that we will avert a lot of problems with the community. And then the trusted local messengers make advice relevant and credible, because the messenger is as important as the message. We also, meaningful inclusion requires, representation, participation, accountability, and influence. And there are priority groups like women, girls, youth, people living with disability, and we also look at gender sensitive, RCC messages as well. You cannot build trust or inclusive system from zero during an emergency. So it means before the emergency, you should have built on trust. One Health, as Professor also mentioned in his keynote address, is very important. One Health makes preparedness practical at community level. Health threats move across people, animal, and environment, because if you look at it, disease triangle, it is very important that you look at all of these aspects. Communities can report unusual illnesses or deaths in people and animals, and then local dialogue supports safer animal, food, and environmental practices. And then in our system in Sierra Leone, the chiefdom and community platforms are, connected, so we need to tap on the knowledge, and then also the technical sector. As I have said, there should be a fine balance between expert knowledge and lay perspective. And coordinated feedback, protects health, livelihood, and trust. And this works within the One Health space when communities understand, participate, and act. Sierra Leone can build on existing community platforms. We do not need to reinvent the wheel. There are platforms for a very, very long time, and we need to build on this platform. So we use chiefdom, meetings, CSOs, trusted leaders, media, and frontline workers. In the district health management team, they are actually very, very much supportive of these, outfits. And then we need to connect community listening with the National Public Health Agency, the Ministry of Health, technical and decision-making structures. And we do not need to bypass any of these existing structures. And coordinate governance, content, activation, and community delivery. And we ensure accessibility and participation as well. And we capture the rumors, the feedback, and comment, and we report back. Because if the concerns are addressed, then the rumors, the misinformation will automatically go down. The campaign coalition brings together 18 Sierra Leonean CSOs with other sub-CSOs some of them are under these CSOs with national and regional partners. And some of them are represented in this meeting. The goal is sustained community-led preparedness. Community-led preparedness, that is our broad statement of intent, the goal. Therefore, we need to build local champions and relationship between emergencies. We have champions and ambassadors. Since COVID, Mpox, and even Ebola outbreak, we've been getting champions and ambassadors that are very much supportive of our intentions. And then we maintain feedback and rumor response mechanism. And then we link our community surveillance. We are working with all core capacities, be it medical countermeasures, surveillance, point of entry. We are working with all. But more importantly, we actually link surveillance and behavioral intelligence and epidemic management with our formal systems. We also measure whether community insights changes action. If they do not, then we need to redesign our strategies again. And then community-led systems, listen, partners, act. So we need to look at this. If the systems listen, then the partners will act. Next slide. So this brings me to the end of this presentation. And I want to thank you very much for giving me a
Thank you very much, Howard. Kindly, colleagues online, you can post your questions to the chat box, and then we can take it from there once we move. So we go to the next item on the agenda. Linda, from your side, can you share the agenda?
Yes, Andrew.
Thank you so much. Thank you so much, Howard, for that technical review. And like I said, colleagues, kindly, if you have questions, if you have comments, kindly post that into the chat box, and that will be time for us to questions and answers. We can also blend that with the CSO reflection, so it gives additional time to all of us to ask questions and give feedback. On that note, I want to move straight to campaign review, the position and anchor messages and message pillar from John Becko from the INASO. Thank you, John.
Thank you. And good morning, colleagues. Good afternoon, Linda. I'm very grateful to be part of this meeting today, the launch, as I mentioned earlier. But before we start, colleagues, please join me in appreciating Professor for his one time to be with us in this launch. It is not easy to get the leadership of the public health agency to spend time in our workers' communities. This shows a lot of commitment from the government working with communities. Trust me, this is very rare in our region, in our continent of Africa, to have senior level public official, public departments, public agencies to open doors and spend time working with communities and welcoming communities and in a partnership. So please join me in appreciating however you can. Please, let's applaud, let's clap, whoever is on their screen. Let's see the clapping. Let's really appreciate Professor for that time. I'm really grateful and honored to be in such a meeting. Yes. Woo! Thank you so much, Professor. So this was really good. The other thing that I also want to appreciate, Professor, is that yes, I know it is really beautiful, and we're really encouraged by that. This is proper leadership and encourages us communities. And communities, remember in our first meeting, we are the ones that are actually late and behind. the government is already ready for us. This is an event that shows that commitment from the government. They are ready for us. We are the ones who are late. So we are very, very grateful to be part of this. The second thing that I also want to appreciate Professor for is that actually his remarks and his speech has actually given us our messaging. It's like he knew, it's like he read our messaging and our thoughts, and he's already delivered them. So it has made our work so easy for us to share our, discuss our messaging and what we want to communicate, because Professor has already done it. He has internalized it, and not only sharing in terms of bullet by bullet, but he has actually opened up the brackets and explained each and everything that we wanted to talk this afternoon. So it has made our work very easy. At the same time, we have confirmed as communities, as civil society, that actually Professor and his team and the agency he's leading actually understands our asks, and they already understand what we are, our business as communities in PPR. So that one is another thing that we really want to thank Professor for. So without wasting much time, I really wanted to spend some few minutes on that, because he has already done a lot of the work, the presentation I wanted to make, so it will be easier for us to go and we'll save time from there. But we can't really ignore the fact that we need really to appreciate the efforts of our public sector colleagues and our leaders. The other thing that I also want to mention before we get into the presentation is that colleagues and friends, we all understand that the work of pandemic preparedness and health emergencies, the custodian of all that work is the public health agency. They are the custodian. They have the legal mandate, authority to provide leadership, coordination, and to mobilize the whole country, including civil society and communities, towards preparing and responding to health emergencies and pandemics. So we are really grateful for this opportunity, because we are actually dealing with the people who are the custodian and the authority in PPR in Sierra Leone. So we are at the right place. They are our leaders, and we are following the national priorities in PPR. So we are very grateful for that. This is a very beautiful moment, and I don't want us to miss that as communities. I want us to keep reminding ourselves that we are in the right place and working with the right entity within the public sector. Now, coming specific to this session, remember we are launching our campaign, Communities, and it is linked and provided leadership and contributing to the national processes led by the agency. What we wanted with this session to look at is what are the pillars in terms of the messaging that communities want to implement under this campaign. Where do we center this communication? Remember, Professor has already mentioned that professors are not just the recipient. Well, communities are not just a recipient, but they are actually the forefront of each and every public health emergency, because all these events happen at a community household. So communities coming in as a very critical players and a stakeholder in this process. So all these pillars of our messaging are centered around a number of issues that we've put them in 5 pillars, and that you can agree with me as we go pillar by pillar, that Professor has already explained them to us. So our work will be very easy. It's just to confirm and put everything into structure. So Linda, next slide. So as we get to we need to take one step back, first of all, to look at why do we want to roll out this campaign. The campaign is contributing to the broader agenda of community engagement in PPR. We already have the public sector government through the agency leading us in this process, developing the right strategies through the NAFs, doing the right performance evaluation through the JEEs and all those processes. Then they lead us in the implementation of everything that is the gaps, in addressing the gaps. But the question is, where are communities in this process? So the broader agenda of increasing community engagement in PPR is our broader agenda. As communities, through the civil society organizations that are leading us, we are coming in now as players that are going to contribute to the agenda and also participate and support and complement our government and the agency in PPR processes. But that is a broader agenda. One of the things that we've seen, and the professor has mentioned it very well, is that communication, risk communication and community engagement, but that part of risk communication. So this is part of it now. We are actually in the implementation of the communication part of the risk communication and community engagement. So how does that fit into our agenda today? Is now the launch of the campaign. Campaign is part of communication. So as communities, when we met, we agreed we can play a critical role and leadership role in community engagement, risk communication. So this is what we want now to, in practice, to launch and do. So that's why this communication campaign is being launched today as part of community role, responsibility, and agenda in communicating, ensuring there's effective communication through the civil society, community leadership, to ensure that communities are getting the right information and are responding in an effective way. So that's the overall pitching this campaign to the broader agenda of community engagement in PPR. We've seen the gap where professors mentioned it. Traditionally, communities were just the recipient. They're just sitting to wait to be given instructions, but the things have changed. With the agency providing leadership, we have seen communities now, even this meeting is one of the evidence that communities are playing a critical role in shaping the communication agenda, risk communication, and community engagement. So that's the overall, the gap we have seen. We are moving, there's a shift where the old model, we were talking about communities, we are communicating to communities, we are communicating to communities, but we have seen where professors mentioned that we are not communicating communities, we are working in partnership with communities to spread the information, the right information to the households and the community at large. So we are moving from where communities are receiving information to where communities are actually designing and delivering this information so that at least we can communicate the government agenda. Remember, when we met last, we knew and we realized that the public sector, through the agency, they will design public policy in PPR. We communities, we will join them in dissemination of this public policy, PPR information, any communication up to the grassroots level. It is our job as civil society, and I think we are up to the task. So next, Lena. So that's the shift. Now, the 5 pillars, before you go to the 5 pillars, I also want to mention that they are based on a number of principles. One is clarity, where we see community designing, crafting, and picking this public sector information to communities in a way that it is clear, well understood, and appreciated by communities. There's coherence across the media, the form, the platforms, whatever channels we are using, we are speaking the same language, providing accurate, safe, and true information that is based on evidence, science, and it is of course, vetted and approved and authorized by the agency, because they are the custodian of the whole process. We are just the implementers. So whatever we do, we work with the agency for him to be able to look at this and give us the go-ahead based on the science and the evidence that the agency has. Then we also provide accountability to ensure that at least we are accountable to communities, our government, and also all the partners that we work with. Next, Linda. Yeah, so the 5 pillars are: we trust before crisis. Professors mentioned this very well. Communities strengthen early warning. That's the second pillar. Inclusion is preparedness. We will see that as we talk about it in detail. One Health protects livelihoods, and sustainable financing it should be able to sustain our resolve and our activities. Yes, next, Linda. So these are the 5 pillars, but if we open them up and see what we mean by each, I think it will be very easy to go through them very quickly, as again, relying on the speech and the opening remarks of Professor. I think he's done a very good job in explaining all this, what we are planning to do. So what is our communication agenda and the media, the campaign? we want to put forward the notion that trust, we need to build trust before any crisis comes up. Trust is very important. And when you talk about trust, we're talking about the larger community at the grassroots level. People, who do they trust? Can they trust the civil society? Can they trust public sector? Can they trust even local leaders, the chiefdoms and everyone? That trust is very important. It's the most important part. Whenever there's a crisis, you don't need to start dealing with trust. If you already have a trust, it is very easy to mobilize communities to prevent, to respond, and to recover, to build back better. It is easier when there's trust. So our campaign this is one of the themes that as we roll out, it's going to be based on, first of all, we need to ensure that our communities contribute to building trust. We already know our public sector, the agency, will help us to do the policies, to give us strategic direction, but we communities, we need to work with our community members. Civil society need to work with communities to build trust. We need to be very intentional about that. Why do we need to do that? We need to already understand that communities that already trust the health system and the leadership across the health system are very easy to cooperate during a crisis. Very easy to cope. We've seen cases in Ebola. I think Sierra Leone can give us very good lessons learned, where when communities trust the information that comes from the public sector, it is easier for communities to respond and to comply with public health safety measures. We will not look at containment measures from a position where we are suspicious. No. Communities will look at these containment measures in a way that, because there's already trust, and implement knowing that we have the public good at heart as we implement any containment measures or any measures. Then communities strengthen early warning. We understand that. That is the second pillar, that once we have community structures and processes in place, it is very easy for us to be able to have a stronger early warning system. And this contributes to the community surveillance. We have our CLM mechanisms and tools. These are things that we can use. But we need to be able to have information and communities prepared to be able to do early warning. Next, Linda. Then inclusion in preparedness. I think this is also, we also understand this. Not all members of our communities are affected the same way in any pandemic or health emergencies. We have some of our community members that the impact is bigger relatively. We have women, we have children, we have persons with disabilities. So all these groups, sometimes they find themselves most at risk when it comes to public health emergencies. So our messaging is that we need to include everybody, and we need to be very purposefully preparing and working directly with most at risk brothers and sisters in our communities to ensure whenever there's a health emergency, a pandemic, that these populations and these brothers and sisters are protected, and also the response does not hurt them, and they're in a well designed health system. Now, we also have One Health Protects Livelihoods. This one, our messaging is also going to be part of it, to ensure that at least we have all the human, animal, and environment interaction be part of it and communicated, and ensure at least community understand the interaction between these three domains and effective response towards that. Next, Linda. Then the fifth one, which is the last one, we want sustainable financing will sustain the readiness. Now, I think also Professor mentioned this in his opening remarks. And also we've discussed this a number of times, that communities are in the forefront. Communities are the first responders in most cases. But you will see in most circumstances across the region is that we have community actions and activities not very well resourced. So there's gaps in financing community engagement in PPR, right from preparations to the response and to recovery. So our messaging will also focus on that, to ensure how do we increase financing and sustainable financing for community activities. How can communities be part of the process, very well financed, to be able to implement community interventions. Yes, so go back to the one slide, Linda. Yes, so these 5 pillars we've seen right from the trust, early warning, inclusion, One Health, and financing are actually all interlinked. The messaging here will have more of a logical correlation between each sphere. If you look at financing will support everything else that we are talking about, and communities are looking for more domestic resources for PPR action that will sustain One Health, that will sustain inclusion, that will sustain early warning, community systems, and will also sustain that trust building. So all these pillars, the way we structured them and the way we looked at them, and remember these ones were generated from our face-to-face meeting that we had in Freetown. We now want to see how they can be connected and how the messaging will be able to ensure at least there's increased community participation in risk communication and community engagement. Next, Lisa. So these are the 5 pillars. Next, Linda. What we need to do is we are looking at what in case there's any comment, but no, if there's no comment, then I think we really want to see how we can adopt these 5 pillars to form the basis of our communication materials to communities, partners, and other stakeholders. We also want to amplify reach from your end. We join hands and ensure at least we cut across sectors, and we have reach up to the grassroots level, local leadership, up to household level. We also want to commit to feedback. At least we ensure at least how do we, when we roll up the campaign, how do we get this feedback and how do we integrate feedback mechanism within our campaign. And most important, we can't forget this, which is financing. We want to also advocate for financing for community action in PPR. Yes, so with that, I would like to say thank you so much. Once again, I would like to appreciate the speech by our professor, which has actually captured each and every pillar that we've spoken about. I also want to mention that AHF, as our partner who has actually provided this platform for us, I want to appreciate them for their effort and also coming in to ensure that at least we have this activity happening. And remember when we started our face-to-face meeting in Freetown, we mentioned that this is building into a bigger community engagement program led by the civil society organizations that are leading this now. So we have very good feedback from the HF country team and also the HF regional team. And I think we are progressing towards a very good place where we're going to have more engagement with the HF Global. So at least we can see how we can transform this into a much more bigger program that can be able to help us reach across the country. With that regard, I'd like to say thank you so much for the civil society organizations that have been in the room, right from the time we started with the first meeting to this level where now we have reached with the designing our community messaging and moving forward to the next steps. I'd like to say thank you so much for your leadership. Actually, this is something that we can easily hand over to the leadership of the civil society within Sierra Leone for them to take it up. And our role will now to mobilize resources and mobilize partnership across the region and across the country for effective implementation of this and a much bigger program. Thank you so much, and back to you, Linda.
Thank you so much. Thank you so much, John. It's a quite one. Thank you so much. You talked about all of the pillars, and I think it's very critical. And I saw somebody, Patrick, wash specialist, was talking about how it's really interconnected, and that's really great to have all the pillars connected together. Thank you so much on that. Like I said, colleagues, if you have questions, comments, you can put them in the chat box. And once we come to partners and CSO reflection, we can just put that together and have a quick conversation. Time is really not in our favor. So at this point, we want to open the mic for reflections, quick reflections, so that we can hear from our partners connected, CSOs connected, and then we can go to our campaign calendar. On that note, Yes, just raise your hand if you want to. Yes, maybe we start with, is it Michael? Michael, can you please, it's something you want to reflect on quickly? Michael? Okay, I saw that. Okay. Any other person wants to make a reflection? You can just raise your hand. Yes, yes, Liwa, go ahead.
Thank you very much. My names are Onesmus Mlewa Kalama, and literally joining this very useful conversation from Kenya. I think all that has actually been laid down is extremely very timely. I just have a reflection though. All these conversations we have had time and time again that we need to involve, we need to include, we need to engage. But I don't think we are really touching the most important element, which is actually active resource mobilization and putting money on the table. You cannot really prepare if you do not have money. We are just from the global process of actually developing the pandemic accord, which actually is talking strongly that we need to mobilize resources immediately a disease of a pandemic nature actually comes into space. But looking at what is happening, we are left wondering, should we even change our advocacy strategy and start holding people who make statements accountable? What is happening with Ebola in the DR Congo right now, we are really not seeing. In fact, I was just looking at the news. We actually only have been able to mobilize about 60% of the resources that are needed. If this is the trajectory that we are actually adopting in pandemic preparedness and response, then I think we are really falling short of what we are actually promising ourselves to be. Let's even get back to our own national budgets. How much of our country's national budgets right now have a budget line of pandemic preparedness? Yet we are saying we need to have communities on the table, we need to engage, and we need to ensure that people have the right information. How are we going to do this if we are not willing to put money on the table? Thank you.
Thank you so much for that reflection from Kenya. And I think, yes, that's something we need to really push ahead to look at bringing resources. We want to bring communities, then the communities need resources. We need to have the resources to be able to ensure we prepare well. Thank you so much. Yes. Yes. Rachel.
Yes, hi everyone. My name is Rachel Otu Amponsa. Just a reflection around pandemic preparedness and engaging communities in that process. I heard what Maliwa talked about, that it's important for us to have funding, but I also think that when it comes to pandemic preparedness, it's also important for communities to have information. And so our communities are aware that in your various countries, there are policies around pandemic preparedness. Are you aware of the joint external evaluations? Are you aware of the National Action Plan for Health Security? Are you aware of all the documents such as the International Health Regulations, which provides for pandemic preparedness and emergencies? I ask these questions because if you are not aware of an information, then it means that you do not even know how to engage in the first place, because I've worked around pandemic preparedness a bit, and I know that a lot of the times communities do not know that these processes even exist in their own countries. And so they are not able to make input into them. And so the funding is, of course, very necessary, but then we should also be aware of the national process and what goes on in the national documents so that we'll be able to make inputs. Otherwise, other people will be making inputs or coming up with documentations, and then communities will be left out. Thank you very much.
Thank you so much, Rachel. Exactly, information, the JDE. Yes, people need to have that. I think that's a good reflection. We need to put that into the document. Yes, I see somebody's hand in the room at the headquarters.
Yes, thank you. Thank you so much. Thanks to all the speakers for their presentation. And this just takes me back to the Ebola. During the Ebola, I think one of the actual things that really make us to have large number of infected cases was when community are not involved. We sooner realized that and we tried to create that community ownership. Then we started seeing 0 cases. So it is good that we start the early preparedness response and we make it community ownership, and then we'll be able to see that even when the emergency occur, we'll be able to prepare ourselves, and that we'll be able to fight whatever emergency we need to have. Thank you once again.
Thank you very much, CEO, for that contribution, community involvement as a perspective in terms of reflection, which is very critical. Yes, Gina Michael Shaka, I see your hands up.
Yes, and so are you getting me clearly? Hello, everybody.
Yes, we can hear you. You have 2 minutes.
So, yes, I think my contributions is going to center around like what are our roles as CSOs in PPR. You know, when you look at us CSOs, we think we are really important in engagement in PPR systems because we work more closely with communities, you know, and we listen, we connect and mobilize and strengthen trust before the crisis, in fact, even happen. You know, for instance, at CSOs, we have our areas of interventions and linking them to PPR. I think it will help build trust with communities and also how we ensure like tackling these issues. For instance, with support in regards to health services, reaching communities, it may be in the school or local communities where CSOs operate, and also part of like building communication or the trust that they have. These are also things that tells us that CSOs are very important in this PPR initiative. That's just something I also want to say briefly, because let's link it to what we do, yes, as CSOs.
Thank you so much, Michael. The role of CSOs, the importance of CSOs. Thank you so much. Any other reflection? Yes, we have one hand up in the room at NPHA.
Yeah, thank you very much, colleagues. I am actually reflecting on the need, to build community trust. I'm using Sierra Leone, for example, especially in a situation where your environment is deeply politically polarized. I think when preparing, it is important that we include different parties from different political parties, especially within the communities. And we can attest to that most of this misinformation that we usually have during pandemics are politically linked. So if these political parties, their representatives in the communities are not fully involved in the preparation, it definitely will leave room for misinformation to carry on. So that community trust has to be included, looking at the political landscape, making sure that political parties' representatives are fully involved into these planning processes and how their voices also will be heard. And I think if we are able to really, connect all of these, I believe the issues around building, will definitely be in a very good footing. Yeah.
Thank you very much. It's like also between some reflections here we are having from the room that it should be across, that pandemic preparedness response must not only be a government in power activity, but rather it should be something across, and therefore other political parties must involve. I see a hand up from RCCE. Yes, go ahead.
Sorry, can you hear me? Yes. Can they hear me now?
Yeah.
Yes, go ahead.
Okay, my thing is, I'm just supporting what you said, Sam. Very as recent as the mpox issues in Sierra Leone, we went to Gambia to do some sensitization on mpox and why people need to report. The first thing they told us was that the president has brought some illness that he wants to collect money from. So nobody's going to the clinic. I actually went to one of the PHUs. We sat there for 3 or 4 hours. No single person came to the hospital. So I turned around and asked the nurse, why aren't they coming? They said they don't come for the past, since they've announced that there is mpox in the country. Nobody comes. So we had to go and talk to the paramount chiefs, engage them and explain to them this is not about mother people. This is about your health, our community's health. So after we left Gambia, the first case of mpox was reported. Yes. So what he said is actually true, so we need to act. So.
Thank you so much. That's from Madam Sia, the chairperson for the Technical Coordinating Committee for the Pandemic Preparedness and Response Building Communities Ready at Sierra Leone. And so she's the person chairing that technical committee with Mr. Harold at the National Public Health Agency. Thank you so much for your response. Okay, so I think we want to, okay, one more reflection and then we draw the curtain down on this. Yes? Maybe Linda, you can check the chat box if there's any question or anything, and then you can just, yeah.
There is a reflection from Fatima. In what ways does the project address environmental drivers of pandemics such as deforestation, climate change, or pollution? I think with this, it's where the One Health approach comes into play, because we understand human health, human, animals, and environment do interact and do play a contribution when it comes to occurrence of pandemics. So our campaign will also focus on the One Health approach when it comes to PPR. I hope I have answered your question, but also just to respond on the reflections from Mr. Mlewa and Ms. Rachel. Yes, our campaign financing and resource mobilization is very key when it comes to sustainable community engagement in PPR, and the Building Pandemic Ready Communities has put this in the forefront as well, making sure that we engaged other partners to also contribute to resources and information so that the communities can actually have a platform in which they are meaningfully engaged. And yes, when it comes to information is key, very important, so that communities, CSOs, can also understand the existing channels and the existing documents and information when it comes to community through pandemic preparedness and response. And in our trainings and our engagements, we always made sure that the CSOs do have an understanding of the NAFs, do have understanding of the JEE and the processes that go behind that, so that they can actually meaningfully engage. And even in our campaign, we'll continue to break those messages down in more simpler languages, using already existing CSOs that are well capacitated, so that they can trickle down that information to the community. So make sure that they have all the information that they need. Yes. Another question from Patrick: how will the campaign measure whether these three pillars, clarity, coherence, and accountability, are actually changing community behavior and influencing institutions' response to the priority identified by the communities? Yes. This campaign will also act as like a feedback mechanism for the communities. And as we first said, it's like we want to build trust, but also that's why we are not working in a silo. We are working with the NPHA, we're working with CSOs, we're working with already existing platforms, so that we make sure that the feedback that we receive from the communities is received with the National Public Health Agencies and their partners, and also any technical information on any information that we get or we want to put out there is being verified by the National Public Health Agency. Yes, over to you, Safa.
Thank you so much, Lina. Says one more reflection, and then we will go to the campaign calendar.
Good afternoon, all. Mama speaking on behalf of 117. Mama speaking on behalf of 117. With regards to this building of community trust, I'm seeing my unit as a key unit in responding to the community and the other department agencies that we are working to. But the challenge here is, which I want us to look at, is the delay in response from these MDAs. And if we are talking about strengthening the community, their confidence to call the 117 or call whatever emergency line, sometimes they will tell, the key messages they sent out from RISCOM mostly is to call the 117. But most times when they call this 117, we respond to the public immediately But for the responders to act, that's the challenge, which I think most times it's already the confidence of the public to call 117. So we really need to focus on that area and strengthen these MDAs, because since we outlined them in this preparedness and even on our annual work plan, up till now, there is no way out to call this MDA so that we can have a meeting with them for them to take full responsibilities to respond. Sometimes they have been responding before crisis, but whenever they didn't strengthen this, and for example, like city council, they were responding to destitute on the streets or other emergencies. But since after the Ebola outbreak, they didn't take that responsibility anymore, because no one wants to take responsibility. When they call the police, they will tell you call this number or call that number. And even now, when they make it a responsibility for the 900, the police, for 117 to report to them, they will receive the response and say they have reported. But that decision will take more than 72 hours.
Okay.
So it's also a challenge. If we are talking about preparedness and raising the confidence of the public, we need to strengthen our relationship with the MDs.
Thank you so much. I think what I can hear from the 117, which is the National Call Center, is that there should be integrated response, including not only at the NPHA level, at community level, at the Ministry of Health level, but there should be an integrated response for the other partners that are always part of the pandemic preparedness and response. For example, whether it's the police, whether it's the hospital, whether it's the fire force, all those necessary infrastructures must be connected to one so that we can have that response. Thank you for that reflection. On that note, Linda, I want to hand over to you quickly for the campaign calendar and channel plans, and then we will summarize and close down because we have less than 5 minutes to go. Thank you.
Yes, thank you so much, Andrew, and thank you everyone for the reflections. I will not use the slides. I will just give like a brief overview on how we intend to run the campaign. So today is the first day of the campaign, the launch, and just getting feedback from you, CSOs and partners, on how you have received our message, and I'm really glad for the feedback and the responses. What will follow is community launch. We'll also launch this campaign at community level while leveraging already existing community platforms just to make them aware of this. But also we will be leveraging our digital platforms such as social media, making sure that our message is out there. And also we'll be conducting a series of webinars with regional partners as a learning exchange platform so that we can hear on what has worked in their communities and what has failed and how we can strengthen. We can use those lessons to strengthen our systems. The webinar campaign will run for 1 month, and after that, the lessons learned from the campaign will be used to create a tool that will help communities meaningfully engage when it comes to pandemic preparedness and response. So we will use webinars, we will use IEC educational materials, we will use digital platforms, but also learning platforms as webinar to exchange. So that will be it. I'll continue to keep you partners informed on the specific dates, but they will be running from now the 19th of August to September. Yes, over to you, Andrew.
Thank you so much. Can you hear me?
Yes.
Okay, so as we draw to this launch webinar close, I want to take just a moment to step back and say thank you to everybody present, look at the room, and see exactly how we have contributed to this entire process. So as we conclude today, this launch, I see that there's a lot of reaffirmation on the pandemic preparedness and response, of which we have all agreed that the responsibility is not only based on institution, but it's a collective responsibility by communities, and we should have our community being part of the entire process. For the next months, like she rightly said, weeks, we are going to see this campaign everywhere, on the streets, in the communities, in our health facilities, in our community program, on the social media. We will see, and then we'll gather a lot of feedbacks and ensure exactly how this will carry out to be able to see how best we can do. But just to say that as we move along today, let us continue to share what we've learned today, and to also ensure that we continue to stay engaged, join our upcoming webinars, and also see what we have to do in those communities as well on the great things that we're going to do. On that note, I want to say thank you to everybody who has made it a time to join this webinar, and be assured that we will tell you on the next steps as we carry out now the physical campaign in the communities in Sierra Leone. Thank you very much.
Before you go, please don't forget to take into consideration our comments or questions in the chat box. Thank you.
Thank you, definitely. Fatima, we will definitely take that into consideration. Thank you so much, Fatima, for having your time to join as well. Thank you so much for all of those who contributed as well.
It's a pleasure.
Thank you, and may God bless us all. Amen.
Yes, thank you so much, Andrew, and thank you for everyone who has joined. If you have any lessons learned, let's keep this conversation going. Be sure to share what you've learned on social media, in Instagram or Twitter. We're found at @IENASO, and you can tag AHF in any partner that you think can benefit or can contribute to this meaningful conversation. But without further ado, I would like to thank you, Andrew. I would like to thank AHF Sierra Leone, who were supposed to give remarks, by the way, but I think we are in a few minutes. Maybe Esther, you can just give us a few remarks before, and then help us officially close the webinar.
Yeah, thank you very much, Linda. And I want to join you to say thanks to the National Public Health Agency for the willingness and the expertise that they are bringing on board in this campaign. As we are all aware, today we've officially launched this campaign, and we know that the issues of pandemic cannot be seen as a different agenda. We are looking forward to how we move, looking at something someone said that was critical. How do we sustain the conversations that we have started? And we also need to recognize that sustainable domestic and local financing is quite critical. So what we are going to add is part of our advocacy efforts that are currently ongoing will be largely based on the financing for health campaign. So we are willing to work with this team here to draft an advocacy specific to financing for emergency preparedness. That is something we will love to work with, and I will love to have further conversation with the NPHA leadership, so we pull through advocacy campaigns like that. And we're also open to community. I know that there are various community structures. Even during the trainings, it was established that we do have a lot of community structures. These are platforms that need to come on board, especially when we're talking about the reach in terms of the messaging. All those platforms that we believe have influences in the communities should be available and willing to share messages, approved messages on pandemic preparedness. But thank you so much for the commitment, and NASO team, for making this a reality. We want to say thank you, and we are looking forward to a successful physical engagement in the communities where we find ourselves. And with that, I want to say thank you all, and do have a lovely day ahead for the Sierra Leone program. East Africa, I know you're far gone, but have a lovely evening ahead. Thank you.
Thank you so
Very much, Esther.
Yeah.
Thank you. Thank you so much. Thank you.
Bye,
okay, I think it's a wrap. Yes. Thank you so much, Mr. Safa. This couldn't be possible without you and your organization, CARCAT. You've been a very vital partner to make this thing a reality. Thank you so much. We truly appreciate you. And I think that is it from my end and my team. Yes.
Okay, until we meet again. Bye from the NPHA headquarters.
Bye, everyone.